And we are going to go ahead and get started with our final session of the morning. Continuing in the theme of how can we efficiently run our practices and make sure that we're taking care of business and have time to focus on what we all love, which is care of patients. I am very pleased to introduce Mike Manere. Mike is the founder and CEO of Healthcare Compliance Network, and he's been in the business of compliance in the healthcare industry since 1991. And I got a chance to chat with Mike for a few minutes, and he is really here to help us think through all of those regulatory requirements that we have, and again, need to be keeping our eyes on amidst all of the busy things that we're focused on in our day-to-day practice. Interestingly, Mike also has experience in the military. He served with the U.S. Army's 82nd Airborne Security Operations Team, which he, I think, will bring to that authority and understanding and application into our environment. So, Mike, please join us here, and thank you.
Well, can you hear me? Fantastic. So, I'm going to try to take a topic that I've been dealing with for over 35 years and make it very simple for you. I got very lucky today because the first two presentations really teed me up. And if you heard what they were saying, especially with Paul's presentation, policy, procedure, training, assessments. So I'm going to walk you through today exactly what I've learned with my 35 years of doing this. I work primarily just in the physician world. I service over 1,000 physician practices. I've been through 5,000 site audits. So I know what you're dealing with. This is what our agenda is, and you heard it earlier. What, why, and who. So having a culture compliance and SRA and HVA and threats and all the other things I'm going to try to clear up for you and combine it in so it's a very logical, concise program. But once again, why? Because it's law. Monetary damages. One of the things we heard earlier is the SEO and the reputational damage. Even patients can come in and make a fuss about it, or your name gets put in the paper after you have a violent situation in the hallway and the police do arrive, right? And then who? We got state, federal boards, patients, employees, partners, CMS, private payers, all over the map taking a look at what is healthcare doing and how are you doing it. So once again, that's our agenda, and I'm going to walk you through it very quickly, because it is very simple. It's called the 7 elements of compliance. But here is one of the most highly regulated industries is what we are in today. You guys actually have more acronyms that impact you than any other industry. I was working with a friend who's in the nuclear world, and he has like 4 regulatory agencies that impact him. You guys have close to 37. So we're going to go through some of the hot buttons that I see inside of a pediatric office over my years of doing this. I'm going to touch on exclusions a bit because it's been in the papers and it's been in a lot of the classes that I've been to with the YG, CMS, HHS, and anybody else, including your private payers today. More of the audit trends. I see the telehealth coming at you guys and how you're doing it, when you're doing it, how you're doing it securely, who you're working with. Are you checking the BAA? Are you checking the different things that your telehealth folks are bringing to you? Data privacy has become really big. And once again, the number one fallacy is it's actually your employees and your vendors that are getting you into trouble. So if you pay attention to anything outside of policy and procedure, look at those 2 closely, because that's exactly what the government. You all hear billing and coding. It is one that with the E&M levels, you guys are moving so fast that I look at a lot of charts, or my team does, and you're not even signing your notes on time. So once again, that's a drag for a lot of your office people who you've then tasked to, have you done the OSHA bloodborne pathogen program? No, I'm chasing the doc to get his medical record signed. That's going to change as you start looking at this clearly. I'm going to talk about emergency ops because that's one of my specialties, especially violence. I started the first active shooter training about 20 years ago. Coming out of the military, I could not believe what people were doing inside of your practices. Not so much active shooter, but more workplace violence. The disruption with the divorce, the disruption with the false subpoena. You heard that today too, right? How to look at a subpoena. Well, now you know, judicial. You also have time. Take a deep breath before you respond. And I also say a lot of times, you know what? If the subpoena is coming in for a patient that you know, the number one thing you should do first is call that patient. Let them know you got this request, because it's probably not on the release that you should release that at that time. So here are your acronyms. Then there's more than that, but here are the acronyms that impact you. And as I go through these slides, I'm going to try to keep it small and short to our OSHA, our CMS, our DEA, and things like that, Americans with Disabilities Act. If you've got a building, make sure that somebody, and I'm a disabled vet, you can't tell, right? Well, maybe you can, but I have the right to be treated the same way as any patient. And when my quad friends who are in a wheelchair go to their family practice and are weighed or not even weighed and have a complete consultation while they're still in their wheelchair, it's barbaric to me. Treat them the same way. And if not, use what they call reasonable accommodations. And I'll go through that when we hit those slides. Who else is looking? So I cut these things out for my clients. So here are your private payers. They're looking. It's in the contract that you are signing with your private payers that you've done all of this. And you have a continuous compliance program. Continuous. That means as things change inside your environment, you change your policy and your procedure. Anything changes, whether you use a new Sharp, whether you use a new IT vendor, no matter what it may be, you then need to update everything. So that's your private payer. Here's one from CMS. This is from 2016. What do they say? It's the same common theme: risk assessment, policy, procedure, communication, and training. You're going to see the same thing again. Here's the HIPAA one, right out of the HIPAA handbook: written policies, training, and security risk assessment. So as I looked at this throughout the whole my career, one of the things I'll also let you know, it's very rare that any of these entities are going to walk into your facility without you knowing well in advance. But what I find sometimes is you take that document that comes in, you put it on your desk, and then within an hour, it's got 5 things on top of it. And you have not even known that that's a request for something from some federal entity. But it's the fines which also went skyrocketing at I'd say about 4 years ago. Your OSHA fines skyrocketed, especially if there's something like violence that happens. Or I heard somebody over there talking about pepper spray. I love pepper spray. I also love bear spray because you spray that, it goes all through this room. However, if you're going to hand somebody something to say, hey, this is going to make you safer, like a panic button, have you ever checked it? You ever called your local police and say, hey, we're going to push this button on Tuesday at 3? Thank you for telling us. If you're going to hand somebody pepper spray, you're now going to have to write a policy, write a procedure, and train them on it. So the mentality is, I like anything you're trying to do as long as you follow the steps that are there, but the fees and the penalties have skyrocketed. Here's your safe harbor. So each one of these government entities also have a safe harbor for you. I love this. If you can prove you're taking the best effort, your best foot forward, they're not going to make it willful and serious, which is key. 3 times, 10 times damages if it gets pushed. Once again, I knock on wood. I've not seen that in any of my practices in years, a decade. But once again, the safe harbors are there for you, so you have incentive to make sure your SRA is done every year, right? Now, whether you do it in-house or you send it out, that's up to you. And I'll show you the disadvantages or advantages of both. So there's safe harbors. Again, it's across the board with Medicare. I also know OSHA has a safe harbor, but you guys don't really deal with the injuries that OSHA is looking for under that safe harbor. You're really not. You're not losing limbs on a daily basis. You're not having stuff in your eyes every day. So that's OSHA's side of it also. I have a booth here that's a question and answer booth. So I want to get you guys out of here for your lunch, but I'll be there. You can ask me any question. If I don't know, I'll find out for you. And if I know, I might tell you to call your lawyer. But I'm letting you know that these 7 elements that came out of the OIG's handbook, probably around 1995, are now across the board with anybody, including when I showed you those other folks that are behind making sure you're doing this. So the 7 elements are basically conducting an internal assessment and monitoring, right? We heard that earlier today. Threat assessment, great. It's a big hospital. They have a security team. They have people who do this on a monthly basis, a weekly basis. My physician practices don't have those people. So I'm going to break it down for you on, I always start when I do my yearly audit with one of our clients, or I teach them what to do on a monthly basis, or the weekly checks of your eye wash station, your first aid kit, those little things like that. You can make it very quick. But once again, it's assessing, compliance inspections, building your walkthroughs. SRA is yearly. So your security risk analysis is yearly. Unless you've had changes and you need to update your SRA at that point in time and document it. Document the date, document what did we hear, who, what, why, when, where, Who was involved? Who did you bring in to get consult for your SRA that's being done because you had to change? The HVA, now this is my specialty. I specialize in emergency operations and disasters. I specialize in getting you back into continuity of your business when a flood hits you. And I'm going to show you one of the Maryland's HVAs. You guys really have a problem with bridges and flooding around here. And I'm going to show you how that impacts you. So chart audits are usually, I'm going to show you where the OIG said we'd like to see it yearly, about 10 charts, maybe 5 if you're dealing with many different federal or state payers. But that's basically your assessments. So the goal of the threat assessment, and when I say threat assessment, I'm talking about when you're walking around your facility and you see different things, whether it's a door that's opened. I one time looked at a key fob and I looked at the administrator and I said, I bet you your push button is 5318. How'd you know that? Because the buttons are worn out. So as somebody who sees thousands of offices, I look at that keypad and I can see where it's worn down because you're going in and out of it every day. So that's something to look for, doors that are opened, right? A threat assessment is also, remember COVID? How many of you really knew what a MERV 13 filter was, right? But we all ran around and we called our HVAC people. We said, we need a MERV 13. Okay, I'll come and put it in for you. That's part of your assessment now as you go through your facilities. Not that you have to check if they're dirty or not, but you should make sure that they're at that level that the government said regarding the COVID crisis that we had. But it's a basic walk around. The government provides you with the cheat sheet. I will give you a cheat sheet on all of these. I'll even give you the one I give to my clients to tell you what you need to do weekly and monthly. How many of you actually look at your fire extinguishers, huh? Make sure the arrow's in the green, the hose isn't broken, and the pin is tight. And then you walk on. But if you turn the tag around, you'll see where it mandates you do it monthly. Everybody says, well, I had the state inspector in here last week. That's yearly. That's also part of your insurance program. So the HVA is hazard vulnerability analysis. That's how do you deal with hazards and threats in the environment, human, and technology. Your SRA is basically your high-tech security risk assessment. And your safety program is looking at things such as your eye wash, your emergency lighting. You know, there is a button there and it does say test. Don't be afraid to touch it. And if it doesn't work, you better call your landlord. Or if it's you, go to Walmart, get the DC9 battery. I'm not going to tell you to get on the ladder because then you have to train somebody how to work a ladder. Get somebody to change that battery because that's a number one issue I have when there's a fire, usually in your break room where you have no fire extinguisher and somebody puts that muffin in and runs because somebody asked them to deal with a patient and that muffin is put in for 2 seconds, but it's really 20 minutes. Boom, you got a fire. Now you're searching for a fire extinguisher, which is 50 yards down the hall to the right in the back catacomb. You're engulfed. So you then will have a tough time collecting your insurance payment because they're going to say, well, wait a minute. It was a toaster oven. Where was your fire extinguisher? Well, I had to ask 15 people before I knew where it was. So that's part of your safety program. And that's also part of this whole thing when they talk about threat assessments. I like the threat assessments on patients. You know, if you know somebody comes in with their child on Tuesdays and you know this person is always angry because they had to take PTO, they had to go through road rage because they were late, they come into the practice late, now you can't see them for 20 minutes, and they're already amped up. I'd rather be on the golf course. I don't know why my wife stuck me with this today with these 3. And I also had a case where that gentleman was actually sitting in the waiting room and waiting. The kids were destroying the waiting room. One kid like licked every tongue. I'm like, what? But what he really visualized was the Purell gel that had an expiration date, and it was 2 years old. Now he's staring at that, and he's staring at that. And I got to interview him because he came back and he apologized with flowers and cookies. But he's staring at that, and the MA walks in and goes, pump, pump, and grab the kid. Ah! How do I know you don't have any disease on your hand from the last kid you just left? Well, what do you mean by that? That's expired. He had taken pictures of it also. Now, I also agree. You know, I have friends who go out and spend $800 on a 100-year-old bottle of wine. It's not expired. But Purell, they put expiration dates on it after COVID. So check those things. That's part of your safety evaluation. I know you do it on drugs and vaccines, But that's also part of what you need to do internally. And what do? You write a policy, you write a procedure, and you teach somebody, here's your checklist. Just make sure the PRL is. So once again, look for expiration dates, but that's a threat assessment. Here are other things I find that sometimes we miss in our industry, and that is the physical, the overexertion, the violence, the falling, the noise. I go into your closets, and I see for some reason you stored a box that's about 30 to 50 pounds, and it's above the shoulders. And you're asking somebody to go in and grab that. Ergonomics is not a law or an OSHA law, but it's covered under general duty clause. You told me to go get this heavy box. I grabbed it. I blew my back out. Who's liable? You are. So take everything that's heavy and put it down below. But a lot of times you put the heavy things up top because you don't have to get to them, once a year. So that's also part of your work, your site assessment. Shift hours, long hours, overtimes, competing demands. I have clients who come to me all the time and they're like, I just don't have the staff. That's why Mike is always, because he's always pitching in to make sure there's somebody here to cover for somebody. I get that. Bullying. I've been through every single course on active shooter and workplace violence that's known to man. CPI, ALICE, the 4 Ys, the 4 As, FEMA, Homeland Security. I've been through it. I was even taught in my security team in the 82nd about bullying, because it's the #1 reason for a lot of these issues to pop up. What we forget is sometimes there's internal bullying that you don't know between employees. I had a young lady who finally snapped what was taking place, and I kind of love the way you guys are really tight-knit. You remind me of my Ranger unit. You know, you really can brag on each other, but you love each other. But at the same time, the bullying, you don't understand what was going on. So this young lady was walking in every morning with like a $32 latte from Starbucks, mocha, almond, whatever. And every time she put it down, they hid it in the vaccine cabinet. Now it's a compliance guy. I'm like, what are you doing? Put it in the one that says for food only, not in the one that has a sticker that says no food, right? And they did that, and I don't know where it went. And she'd be like, oh my God, what did I do with it? She'd go out to her car, check her car, forgot she was doing it. Finally drove her to a point where she had to say something to somebody. The administrator called me. I said, well, let's go talk to folks. And the minute we started talking, communication, everybody was like, sorry. And it was over with. But those little internal bullying things really impact the way your employees work together. Biological, we went through COVID, bloodborne pathogens, needle sticks. I know with your needle sticks, you guys are working with some of the safest needles I've ever seen since they came back, in the early 2000s with safer needles. I still advise every once in a while, if you think you have the safest needle in the market, I bet you do. I would still call your vendor every once in a while and say, hey, Mike, is there anything safer you got out there? Nope. How about a sharps container? Well, yeah, there's some new sharps over there. Try a sharps container and see if the staff likes the sharps. Still evaluating your sharps. Or if you put a sharps container on one of those rolling silver bins you take between the patients, this is not secure, right? The law says secure. It doesn't mean bolted to the wall. I know my pediatric practice is like, I'm not going to put that low. The kid's going to go in there and grab it. This is secure, right? It's not going to go either way if there's a wall this way. So security means you've gone and done your threat assessment that it's not going to tip over because you move that tray and it falls over. And the last is your chemical hazards. You guys have really depleted a lot of your chemicals. So I'm not worried about your secondary labels, but if you take alcohol and you put it in that little bottle still, you need to put an NFPA label, right to know label on that to tell me I'm allergic to alcohol. Then I can come to you and go, hey, Eric, I'm allergic to alcohol. Don't use it then, Mike. Fantastic. Point being is that's your chemical side of it, but a lot of times you guys have moved through that. Here's your hazard vulnerability. Now, I've taken the Joint Commission because Joint Commission will then start moving into the federal guidelines because the feds look at what they're doing, and your hazard vulnerability analysis is just one you're doing on your environment, your technology, and human-made. Could be a jailbreak, could be a lot of many different things. But the organization, once you put together your HVA and your emergency operations plan, what do you want me to do if there's bomb threat? What do you want me to do if there's fire? Flood. What do you want me to do if all of a sudden there's a civil disturbance? I worked with a client whose office was outside of the Ohio State football stadium. I didn't know it held over 100,000 people. By the end of the game, there's 100,000 drunks. They always found these people in their fountain, swimming, cavorting, doing whatever they were doing. That's civil disturbance. Do something about that. Stop that. Because once you let it go on, what you're allowing it. Somebody gets hurt, what's going to happen? You allow that to happen all the time. So an HVA is basically built together so that you can then improve your plan when something happens. You get shut down. And I know you work with this on your SRA. All of a sudden, your computers go down, right? How do you get them back up? You call your MSP. You call your cousin who's your IT person, and they can manipulate it through that. But once that happens, then how can you correct that from not happening again? That's what an HVA, SRA, and a safety plan does for you once something does occur. Learn from it, and then change your plans themselves. So here's your guys in Maryland. So I took the time to take a look at Maryland's HVA. And once again, what I found, which then should coordinate with what you guys do, right? Because it's from your county and it's from your state. They're worrying about floods and they're worrying about 33 bridges right now. So if you're in a practice that sits on a river that floods all the time, or you're sitting in a practice where people have to travel over 3 different bridges and 2 of them collapse, what do? How do you get your people in? How do you get patients in? What are you going to do if the office gets flooded? Have you moved your servers at least 2 feet off the floor because you know you're in a flood zone? So even the state of Maryland puts this out there for free. All you got to do is go online and look up Maryland's mitigation plan. I suggest you then go to your county. Say, what's my county thinking about? Because that's a lot closer. And sometimes you look at your county and you're like, what are they talking about? Might be a prison break. You didn't know there was a prison 5 miles away. So there's a lot of little things that go through your HVA. And once again, you can get online and you can find all of it. I always say go state and then county. Some towns have done them, but the towns usually rely on the county's HVA to build their plans. Office of the Inspector General, here you go with your chart audits. Okay, so the OIG basically has come out and said if you're going to contract with a federal entity, or you're going to take grants from a federal or state entity, you should be reviewing the provider's charts. Sample size basic guide is review 5 or more medical records per federal payer. I always recommend 10 per year, random sample for all my clients. Just random sample, let's see what we got going. You can do it internally. I always suggest at least once in a while, have an external person come out. Because I always believe if you have a good auditor, not a coder, an auditor, a coder codes, an auditor audits what's been coded. There's a big difference there when they're looking at your notes and seeing a pattern. That's what happened with AI and also with your EMRs when you guys were cutting and pasting, right? How quickly did the feds pick up on that? Wow, every note sounds exactly the same. So that's the OIG. That's what they're expecting from you. That's all part of your assessment. So all these slides just go back to your assessments. And there's many of them. So once again, what does the Office Inspector General say? Develop standards, do this, do that, and involve appropriate staff. So one of the things about appropriate staff is it happened with the needles. So way back when you guys were asked to look at safer needles, you were shell-shocked at the price. And back then they were. You were like, ugh, right? So what you did is to do your needle evaluation, you brought senior management. And they're like, we don't like it, we don't like it, we don't like it, we don't like it. The minute you brought a staff member and they're like, wow, I really like this, right? So they wrote the guidelines to say you have to involve non-managerial folks to be able to take a look at different devices that you're using. It can't just be senior management anymore. Document and provide education from the audit results. So you don't need to send your providers to an all-day class on coding. Usually after the chart audit, there's a really good lesson to be learned there. And most of the time, the docs that I've been working with really like that now, because most of the time, and I say this because you guys are undercoding, or you're moving so fast that you're missing things. So even though it might be docked as overcoding, you actually did the work. You just didn't document it right. So a lot of those things do come out. And once again, it's all part of the threat assessment. It's all part of what I'm trying to say is this is all assessments. This is what you do. But you're doing a lot of it now. You just don't document it. So here's your security risk assessment. Once again, under the Code of Federal Regulation, CFR, right? It says assessment of the potential risk and vulnerabilities. What's your potential risk? Do you have a lot of this that takes place like you guys do with flooding? The pros and cons of doing an SRA internally or externally. I always like to every once in a while bring in a real IT geek, like I'm a compliance geek, because they really understand it. They really understand what NIST, and you have a free SRA online. from NIST, the National Institute of Safety Standards, right? It's free. But when you open it up, you're like, oh. So that's why sometimes it's easier to bring somebody externally who just does it for a living. And it should be done annually or when there's changes that occur inside of your facility or with your infrastructure when it comes to different things you may be purchasing. That's why I also say to you, if you do have a panic button, please check it once in a while. Please make sure it works. And it's easy. Just call your local police department and say, hey, we're going to pull this drill. They're going to be like, psych, we'll send an officer down anyhow. That's what you want to get an involvement, especially when it's violence. And I've been asked many times, Mike, what is the most violent by my handlers at FEMA and Homeland Security and SWAT? I used to say it was the drug docs. This was years ago. It was the drug docs. Could have been cardiology too, because no one ever wants to take blame that my dad died of a heart attack. No, you did it. Lack of care, right? It's pediatric offices now for me. And the violence I see inside of your practices from divorced children, behavioral health. I mean, how many of you brought behavioral health into the office? Well, here's a good thing to assess. Open that door and make sure that behavioral therapist is the first one that can get out of that door. Instead, what you were doing is you were setting your desk here and the door was there. This kid comes in, he's 12 years old, he's 220 pounds, and he erupts in anger. Now he's in front of the door. What do? Whereas if you get the first way out, that's called situational awareness. So look at that. That's part of your assessment. That's also part of what I call the HVA. Exclusions. I'm getting a lot of calls about exclusions. This is mandated. This is not a query check. This is not a background check. This is so you make sure anybody you hire to work with you, subcontractor or full-time, part-time, no-time employee, you've run them through the OIG database, which hits 27 with the states, 43 different states. And you must be able to prove you check this person out on the exclusions. If that person is excluded, the fines are astronomical based on what that person did in your facility, and a percentage of that they're going to ask back for because that person should never have been in your practice. Now, exclusions are free online. Go to your OIG database. The problem with it, and I built my own software because I was sick of doing 5 at a time. I work with practices that have 1,000 people in them. I got 5 at a time. I'm like, gosh, no wonder you don't do it. But point being, I also tell folks, if you're going to do this in-house, do your new hires. Even do them before you hire them. You guys hear the case of the woman in Hackensack, New Jersey, who they brought in? She was a traveling nurse. She was the one who lit another nurse on fire. She was excluded for drug diversion. They still hired her. She also had the wherewithal to know that they needed her there because they hadn't been able to fill that position. They let her work, and then what? They got lost in the crowd. They probably would never have picked up she was excluded until she got busted. Then everybody ran through everything they needed to do. By that time, it's too late. Okay, so that's your exclusions. It has to be done monthly. The OIG says monthly. I tell my clients, you only got 20 people working for you. Do the first year every month. And if those 20 people have never left you in 30 years, you can move to quarterly. I'm not telling you to do that. Because the OIG says when we update it on the 9th of every month, we expect you to update your list. We expect you to do the same thing. Being able to say, I didn't know. There's no excuse anymore. You know. Why? Because you signed all those documents that said you're doing all of this. So once again, all of this falls through what I call your assessments. That's an assessment of your folks. That's your assessment of your people. Just like your building, just like your sharps containers. Folks, please help me with this one. Because DEA is coming down hard on this. If you're throwing your vials of pharmaceuticals inside of your sharps containers, you're wrong. And I'll work with you on that. But I see so many things going in the sharps containers today. And I also understand, I think it's called Ozempic. And the needle's like this big. And by the time you put it in your sharps container, the lid of your sharps container won't close anymore, but you still try jamming it around it. And you can't do that. Get a bigger sharps container. So, once again, here's mail-in Medicaid. There's their sanctioned providers on the monthly basis. So you got to check states and you got to check feds. And that's all part of your exclusions, which is part of your assessments. So number 1 is assessment. I gave you enough slides to confuse you, but it is basically simple. Walk around and see things. Talk to your folks. Ask them about certain things that they encounter, they see, or they've done. Hey, we don't have a place to put pharmaceuticals. And I was in a lecture where this crazy guy was telling me I can't do that anymore. Let's research it and find out. I will tell you now, if you took the time to research those little vials of pharmaceuticals, most of them are non-hazardous and could probably be put in the regular trash because there's nothing in it. I can't tell you to do it while standing up here, but I look at my client's trash. I'm like, that's not a hazard. Well, isn't the glass hazardous and a sharp? No, it's not a sharp. But you need to research that. And the best way to sometimes research it is the manufacturer overrules everybody. The manufacturer tells you to do something, then that's what the government will go by. You need to put together a compliance committee. So your compliance committee should be made up of a few different staff members, including a few from senior management, but it should never be a CEO or CFO because they're usually the ones committing the crime or at least hiding it. They can get over it. I hope there's no CEO or CFOs in here, but just make sure you have a compliance committee. It's well documented. I always suggest at least meet quarterly. I like my clients, they meet monthly. It's 5 minutes. Hey guys, this is what we're doing. Have you seen anything? Or we tried those sharps last month that McKesson put in. What did you think of it? Here's the report we got back. That's it. You've done it. It's over with. Move forward. Somebody might say, every day I come in early and there's a gentleman in the bathroom taking a shower in the toilet. What? I've had that happen in these sanctuary cities where folks are actually going in and my heart bleeds for them. But an employee should not have to encounter that. You should know that door is jarred open every night. And whoever was jarring the door open, we've never found out. But the minute we unjarred it and then we put a note back there, this door must be locked at all times. It never happened again. The employee really respected that of management because you took action on something that they, came to or that they brought to you. Policies and procedures. This is one you guys really dislike because you have thousands of books already, and I love the clinical side of it. You need to have policy and procedure on almost everything you do, including pepper spray, right? If you're going to give it to somebody. So when you take a look at policies and procedures, your standard code of conduct, ethics, do the right thing. OSHA safety, what do you do if this happens? How do you deal with violence if it happens? Who do I go to? The key here, and you've heard it earlier today, site specific to the environment where the employees are working. So if you took a canned shelf from your canned program from your garbage company, I love Stericycle's book, but none of you took the time to put it together. When I open up the book, it says 1998, right? That's not a book that's going to get you, what's this conference about? Into a defensible position. It can say 1998, and as long as you have update tabs that say we've updated it through all the changes that took place under the Department of Labor's guidelines. HIPAA, federal and state. I still see folks, and I don't know why you guys are doing this, but I had a client tell me, we put our notice of patient privacy online in our portal. I'm like, oh, great, I can't use a computer. Well, then we'd hand it to you. Do you hand it to me every time I come in? Because you only have to hand it to me the first visit, right? So I always say for $3.79, why don't you print it and just tack it someplace? No one will ever probably look at it, but you're putting yourself into more of a defensible position to get what? To get your safe harbor. So I look at things, and you might have been told that by somebody. I agree. Who doesn't have, I always want to build books, right? The only book you really need to build today is your safety or emergency operations book. And the feds and Joint Commission still believe that there's an emergency, have the right to go get that book because I might get outside and there's no Wi-Fi and there's nothing I can look at. There's a disaster here. Who's going to go get a book? Just run because you taught me that. But that's why printable manuals with your OIG guidelines and even with your HIPAA guidelines, you can probably keep those electronic as long as everybody has access to it because there's not an emergency situation. That's the difference with the policies and procedures. So here you go. That's what it's all about. Hardware inventory. How many of you really lock your IT room? Right? How many of you lock that? And keep it locked. Because every time I go in, I pull on it, it opens. Well, the lock doesn't work, but it's locked. What? It's just like the keypad that's worn out. It cost them, I think, $100 to replace those buttons. I said, did you replace the code? We got to do that now. But once again, HIPAA policies go through. I'm imploring you, please look at your business associate agreements. Please review them periodically. Companies get bought, companies get sold, companies change. Some of you, I go into and I open up the BAA file and there's like 700 of them. Your landscaper is not a business associate. Usually it's the person dealing with your PHI. Even some reps who come in to visit you, you are not taking. And I asked Linda Sanchez, the head of HHS years ago, I go, Linda, would you please clear up to me? What do you mean by that? Okay, Mike, here's very basic for you. Mike, go to work. Here's a medical record full of PHI. That's a BA. Hey, Mike, go to work. Here's the PHI. I go to work, right? I'm not touching PHI. So you have to evaluate every one of your business associates. And please, if you do anything after that, just look at them. Pull them up, see the dates on them, try to get them updated, ask the team, are there any changes here? And if your pile is this thick, go through it. Make it this thick of the ones you really need. Much easier for me or you guys to manage. I've got all our clients down to this now. And anytime they've been audited by a desk audit, they've been audited live, we've always won. Why? We're in a defensible position with that because we took the time to look at it. Workplace violence, that's the facility assessment we heard Phil talking about. So I always go in and I'm like, okay, listen, why do you have that Visa MasterCard machine sitting there right out front? Well, because it's easy for the patient. Well, can't you take it from where you are and then hand it to the patient? Oh, of course, but why? I'll tell you why. This happened in a urology practice. They put the sign on the door that said, we will be back at 1:05. Well, where were they for lunch? They were in the back with a pharmaceutical rep eating. The lone person at the desk, all right, she'd been there for maybe 90 days, really psyched for her job, wanted to escalate to an MA and get in healthcare. She goes to open the door, and there's about 15 people waiting. This guy must have been about 6'4" and 280 pounds. He pushed everybody out of his way, and he went to the front of the desk, put his hands down in a violent situation, and said, I need my prescription now. And she's looking at this guy. She's like, oh, let me go in the back and ask. Went into the back and asked somebody, and the nurse came out and said, he needs his referral. Oh, fantastic. You need a referral. This is Friday at 4 o'clock or 1 o'clock in the afternoon. The guy took that Visa MasterCard machine and pancaked her in the face with it. All because he couldn't get his Viagra for the weekend. And now I'm sitting there and so once again, I have these uh-oh moments and I kind of like them as a compliance geek. Man, I want to find out why. That's barbaric to me, okay? For anybody, especially somebody that size, to do that to somebody, but it happens. So I share it with you. If you can move it, and then every time, oh, you're paying with Visa MasterCard? Here you go. Even your pens and anything that's laying there, even your office. If there are things that I can pick up and throw at somebody, especially some of the chairs you guys have in there and a lot of the kiddie chairs that you have, especially the wooden ones you still have from 1960. Maybe get some of those plastic ones from Home Depot because if they hit you, they're not going to really hurt you. That's part of your whole assessment, and that's part of workplace violence. Write your policies. What do you want me to do? Check your panic buttons, response processes, include all your staff, open communication. I've done probably close to 400 active shooter workplace violence trainings with de-escalation and practices. Every single time, every time, the staff really appreciated it, thanked management, because they'd all been talking about it behind the counter. They didn't want to bring it up, that something happened the other day, right? Now, you heard what Phil said about changing some things. If you know somebody's always violent when they come in on Tuesday with their 3 kids, I gave you an example at the Purell. You never know where somebody woke up in the morning. So be prepared with it with a good workplace violence program. It is going to pass federal law. Our president's sitting on the final one. House and Senate did pass it. It's going to make it a felony. It's going to put somebody in jail for a while. I love it. Because just like you guys can't afford a gun detector, right? I mean, what pediatric practice is going to get a metal detector? You're not going to do that. Point being is as this passes, it's going to hopefully put the fear of God in the folks that, hey, this is a place that, and if you have a gun policy, no guns in our facility, right? Most healthcare facilities don't want that. Please train your staff on what to do. If I show up with my Glock 9mm fully loaded and ready to go and say, I have a license to carry. Who are you to tell me, right? Now you start de-escalation. Oh, part of our policy in the pediatric practice is that, could you please leave your weapon in your car? No, I will not. Let me go get management because maybe we should reschedule this at a better time for you. So point being is that's part of your that's part of it. And I know it happens. I talked with somebody the other day who helped the nurse told me they helped their kid get onto the scale, and when he put on the scale, the gun fell out of his back pocket. Boom, boom, boom. right? What do? You had somebody sitting there go, do I say anything? Do I like fake like I don't even see it? No, let's engage it. Let's teach everybody what we need to do about it. That goes to training. Training is mandatory. Okay, and it goes the same way. I don't care if it's OSHA, HHS, HIPAA, high tech, DEA, CLIA, Americans with Disability. Train your people on what you want them to do. Train them to say, hey, you know, Mike's coming in here with his child and he's in a wheelchair. How do we get him into that room? Because he's also obese. And all our doors, we've only tested with the smaller wheelchair, right? What do you do? This is what we're going to do. Reasonable accommodations. I've made a pact with the guy down the street who has complete ADA accessibility. Great. That's called reasonable accommodations under those guidelines. But it's yearly. New hires. I implore you to do your new hires. I know it's tough when you're doing it in person. I do both. I do online and in person. Online works for your new hires, especially when we were talking about the rate of your turnover hitting over 23 to 28% is huge in any industry. But I understand what's going on in your industry. I mean, when somebody's sitting in their desk and they see through the window that Qdoba is offering $19.75 and you're paying them $19.50, but they get 401k and health on the day they go, and all of a sudden you wonder where that person went and they're working at Qdoba. I get that. I understand that. But once again, train everybody. Make sure it's robust, not off the shelf, and make sure it's site specific. This is what I want you to do if this happens here. If this happens here, where are your safe rooms? Right? Our safe room is a locked door to begin with. A lot of people say, but it's got a window. Put a shade over the window. Give me a place to go. Bathrooms. Any door that can be locked, you can make into a safe room. If it has big windows, do something about it. I have never encountered an active shooter, and I was a sharpshooter, who could shoot through glass and hit you while you're running to your assembly area. Never happened, right? Because under active shooter, how long do we have to live? 5 minutes. The good part about it is the shooter, the bad actor, knows that too. It's different than a violent situation or a violent incident. A violent incident is I came to get you. And if you all get in my way, I don't care. That's never happened either. So point being is put together, make sure it's robust. Where do you want me to assemble? Under active shooter, it's different than fire. With fire, what can you do? You can go out like you do, you practice it, you sit behind the fire truck and you go, wow, look at that building burn. Active shooter's 360 event. They want you at least 100 to 200 feet away from that building in a secure area that you can all congregate with the amount of people that you have. If you got 5 people, yeah, you can get behind a dumpster. But if you have 200 people, it's a little different. So that's all part of your policy writing, and that's all part of your training. Where do you want me to go? Effective lines of communication, hotlines. You need to give me ability to be able to rat you out. If I'm an employee and I feel you're doing something wrong and I feel you're abusing me or you're doing, I want to be able to call somebody. The guideline says it should be confidential with no retaliation. However, you can give many different ways to communicate. I always say offer a Dropbox, offer your CEO, your lead MD, because if I feel confident talking to you, I will call you, right? Because now I've elected not to use my confidential hotline that you provided for me. But a confidential hotline does not need to be one of these $1,000 human voices. It just needs to be answered by somebody who doesn't know the voice, right? So if I work for you and I call up and I'm like, hey, you know, James is doing this. Mike, how do you know James is doing it? How do you breach the confidentiality, right? So point being is you need a hotline. You need a way for me to be able to communicate with somebody when I see that something is wrong. So you need to be able to report compliance concerns, suspicious or improper behavior, non-intimidation, non-retaliation. That's important with your hotlines. Once somebody says something, you need to look at it. And once you look at it, you need to enforce it. You need to make sure people know when you're going to bring your sanctions. I like the escalation determination. And every regulatory body says, if this happens once, what do you do? If it happens twice, what do you do? If it happens a third time, what do you do? Especially when you guys are doing your phishing exercises and your IT folks send one of those bogus emails. And at first, it's 90% of everybody opens it because ADP says if you don't hit this button, you're not going to be paid on Friday. And you all hit it. But the next time it drops, and the next time it drops. And that's all part of your enforcing your standards. So once again, the sanction HHS, civil rights, as a reminder, HIPAA regulation and entities, sanction policies. What are you going to do if I keep breaching something? What do you do if you catch me stealing medical records because there's credit cards and that information, right? What do you do? And number 7 to end with today is responding properly when you detect something. Do not turn your head from it. Go and investigate it. Also include other staff members. Go and investigate what took place and start putting together remedial sanctions of what you're going to do. So once again, responding properly is really good. Same thing, corrective action, team approach, follow through, and keep good notes. The good notes are what will save you if it does go to the court of law, because they show a pattern. You heard it earlier, who, what, why, when, and where. Write it down, see what's going on. So those are your 7 elements. How was the practice notified? You heard that today. If it's coming in regular mail, I will almost guarantee you it's not a real legal binding. If it's not a judicial order signed by a judge, then you might want to second guess it and call that courthouse. And like Paul said earlier, the court is usually open when you are, okay? Call, find out, and then call the patient. Say, hey, we got this notice from the school, because I see a lot of it coming from schools. We just want to let you know that, and we're going to take steps to find out what it's about. Do's and don'ts. Do comply. Do copy all records. If somebody wants to do a chart audit and you get somebody calling you up and say, we want these 100 charts from this date to this date on this patient, send only that. Don't go above that. Don't go below that. Do exactly what they're looking for. You guys have really corrected that, so you're doing it. Don't give up control. You own that. You own that, okay? You work with them. There is no one who's ever been thrown in jail because you said, whoa, wait a minute. I want to take a look at this. I want to research this, and I want to give you exactly what you want. But I'm not going to rush into it. You keep your control, and that's what we heard earlier today about violence, right? You own the interior of your practice, but have your policies on it. And don't send what is not asked for. When I see that a lot of times, if they're not asking for your training records, don't send them. Because a lot of times the Department of Labor will ask for other things and you send your training records. You don't need to do that. Send them what they asked for and then have them come back and ask you for the training records. Here's an OSHA. This is another risk assessment. You know, if so attached, was the risk assessment shared with employees? Was the risk assessment implemented, and describe how? That's a letter you will receive from the Department of Labor before my friends at OSHA will walk into your facility. They don't want to waste their time with bogus phone calls, because OSHA also has a whistleblower line. Here's some new things. I'm going to run through this quickly with you, but this is things that have changed in your industry. So adapt to it, right? I mean, service animals, right? I have people call me up. Hey, Mike, is this 8-foot snake a service animal? No, it's also not a comfort animal. As a disabled vet, I'm telling you now, it's a dog or a small pony. I've never seen a small pony being used inside of a physician's practice. So I'm just saying, when you look at the Americans with Disabilities Act, you know, you can go out and buy that vest that little Barnaby has right there that says, I'm a service dog in training, right? You're not supposed to ask anybody, you know, you're allowed to say, so what does the dog do for you, Mike? Oh, it helps me lean because I lost my leg. Fantastic. That's part of the ADA laws. I suggest you look at that. And you know, there's plenty of placards you can put on your door. If you don't have one, call me. I'll send you one. This is a service animal. This is a comfort animal. We allow service animals, not comfort animals. It really stops that person. We've seen many people go back into their car with their laps and go, you got to stay here today. And, you know, so everything else that you see here, the no weapons one, you know, the bathroom issue, you know, if you don't have bathrooms, you have bathrooms internally, but you want everybody to use the hallway bathroom, right? But somebody comes in and goes, I need to use your bathroom, right? No, eruption of anger, right? So make sure you have clear signs. And, you know, I've got people now who, when I saw that sign, I just had to take a picture. Whatever. Come on. You know, somebody's going to say something to you about that one. Other compliance issue, your waste stream, workplace violence, the CSA. I'll go through this quick. That's the pharma rule. Check your pharma containers. It's okay if you want to fill it up with gauze. Remember, bloodborne pathogen changed to what? Soaked, saturated. So if you can't twist it and drip it out, it's not bloodborne. It's what it says. But when I started my first company, what was it? 1990, right? We were all panicked of HIV. It was 2 drops of blood. That changed, but you never changed your 10 minutes. Perfect. You never changed your policy. So I see things, including the paper mat you put over your exam table, right? You're throwing that in biohit. And I'm like, no. Also with your exam tables, if you have a rip and tear in it, CDC now knows that. It's almost impossible to clean. And then if you try to clean it and all the chemicals going into the foam, what have you created? A chemical hazard. So be careful of your tables. Here's more legislation for you from Joint Commission. This is where they're really going to take workplace violence. They're going to put you in jail. So that's why I like what Paul said. If you feel threatened, dial 911, write it down, get your local police in there, because once you document it, then you have a trail of that you're trying your best to stop this from happening. Here are your top 10 from the Department of Labor for small and medium and large organizations. Email protection, endpoint protection, vulnerability management. Where are you vulnerable with the management of that? Are you going home with your phones that have all the PHI on it? So you need to take a look at a lot of that stuff under what they call the CSA of 2015, Section 405. I love the acronyms. I'm a military guy, right? So that's why I fell in love with you guys. You had all these codes. There's your BA. Make sure you're taking a look at them. Make sure you ask your business associates, can I see your training program? Can I see the index to your manual on how you train your folks? And it's like, wow, yeah, I'll get it to you. Then you never see it. You need to stay on top of that with them. You also need to make sure they're doing what they're supposed to do, especially with disaster recovery. You need to know what's going to happen if you go down. Here's the Americans with Disabilities Act, right? Reasonable accommodation. Doesn't mean you need to change your office around. It means you need a plan how you're going to reasonably see me in a wheelchair or I'm blind. That's reasonable accommodation, and it can be down. Where I see it is exam rooms, exam tables, and the scale. A lot of you don't have scales that you can weigh somebody. You say, hey, Mike, how much do you weigh? 150? Then I'm 180, right? That's a different thing. So I'm just saying pay attention to that because it is part of the Affordable Care Act. Fraud, waste, and abuse, you heard that again today. Anti-kickback, they have a safe harbor for that now. So they're allowing you to do certain things. The self-referral program, false claims. You guys are really getting more and more on top of that. And I see it coming from a lot of your partners out there, your PHOs, your IPAs, your MSOs, even your hospitals. So in conclusion, okay, oh, I did it. It's a lot to take in. The slides are there. I'm free. Just give me a call. I mean it. Just dial me up to, hey, Mike, this just happened. I will try to answer it for you, okay? There is a recipe to success. That's your 7 elements, right? Let's assess, what do we need to do? Building, people, interior, exterior. Where do we go? Foster compliance with your employees. Don't be afraid to talk about it. The more you bring it up, the more they like that. The more you hide it, the more like, what are they hiding? Why aren't they talking about that? Everybody's talking about this, especially with workplace violence. You'd be surprised at how many people call me and say, listen, my docs are ignoring us and we have problems here. In the Northeast, right? What time does it get dark? 4 o'clock in the wintertime. But you never change the outside lights. They still come on at 8, right? That's part of your assessment. There are your 7 elements that was published by the OIG in 1996. So there's no excuse for not knowing. Fair enough? Thank you guys very much for your time today.